Good evening, viewers. Hope you are keeping safe as we are unlocking through the pandemic. And aptly, here we are with a new series for you. And before I tell you more about it, uh, we'll go with our conventional prelude first. And a quick note on what the Truwellth platform is. Truwellth is an integrative healthcare initiative guiding patients and healthy individuals to overcome their health concerns and manage self-health to reach the ultimate goal of holistic health and happiness. Truwellth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. It also desires to unleash the therapeutic role and potential of nutrition, and Truwell's ultimate goal is to provide integrative and personalized health and nutrition advice to achieve health and happiness. A quick note for you viewers, this live program is organized to get more information and guidance to keep health, nutrition, and fitness during the lockdown and as we unlock and as well as otherwise. And the recommendations made by the speakers and other participants cannot be treated as a personal consultation. For a personalized consultation, you can reach our consultants on 98200 or visit our website www.truwellth.in. You can feel free to ask all your questions on the same number 98200 or you can type your questions into the comment box in the live page that you are watching us right now. However, please note that this program is not intended to provide any information on COVID-19 and related treatment. Having said that, I take immense pleasure to uh, announce this new series which we will be conducting with Dr. Ashish Arbat. Uh, Dr. Ashish Arbat has extensive experience in the area of bone and joint health, and which is why the series on bone, muscle, and joint health by him, uh, especially for you all through this lockdown and also as you come out of it to make the right decisions. It's a pleasure to run this series with him. So before I give you an idea about the series, I would like to give you a quick introduction of Dr. Ashish Arbat. He is the first 3D robotics joint replacement surgeon in the Western India. He's director of orthopedics at the Apollo Hospital, Jahangir Hospital, Pune, the Aditi Hospital in Mulund, the Ruby Clinic in Kalyan, and Cure Hospital in Thane. So many areas, and let me also do a quick screen share of his credentials because they are quite extensive while I go over it. He's of course MBBS and MS in ortho from the KM Hospital, which is the renowned hospital in Mumbai. He is MCH ortho from the Royal College of Surgeons, the UK, from the UK, and he has been a faculty teacher for the UK MCH orth course. He has a fellowship at the Princeton University, New Jersey, USA, under Dr. Jeff Abrams. And mind well, a couple of these people that he has actually worked abroad are very, very expert names in the bone and joint health. He is the first Indian fellow under Dr. H. Sugaya in shoulder and elbow arthroscopy, and Funabashi Sports Medicine Fellowship also, which he has from Japan. And he's associated with the IPL Gujarat Pro Kabaddi League India. He's doing a lot of extensive work in the 3D robotics area as well, like he has done the same with the government of Scotland earlier. He continues to do that here in India, and which is why it is absolutely apt to quickly tell our viewers about. Going to take a minute because I know I'm taking a little bit of time, but I want to explain why we really want to take up this initiative. It being that we are going through a very deadly pandemic, but we have to realize that osteoarthritis, which is your specialization area, Dr. Albert, as we know, it's the 10th leading cause of non-fatal burden on the burden of disease that we have. And it gives a lot of pain and immobility to the patients, which leads to comorbidities like diabetes, obesity, heart disease. And so, in exchange, if osteoarthritis is not taken care of properly, it can actually turn out to be a more deadly combination with the other comorbidities. India is estimated to have about how bad that is even today. And O is more common in women than men, and the prevalence increases dramatically with age. So about 70%, 65 years of age, get osteoarthritis in some stage or the other. And the rates of revision, which means that when you go through your first surgery, the rate at which it doesn't go right, know more about this disease and also know about the treatments that are available at its different stages. And at the same time, it's also very essential that when you're credible, and of course not just going in for the latest ones, which Dr. Arv, of course, his expertise and experience. So a proper combination of all this is very, very essential, and which is the reason why we want to we have announced this series today, and we will be doing extensive programs almost every week coming to you. Through this deadly pandemic, I'm sure a lot of you have postponed your surgeries, and while you're from here, joint replacement, partial or total knee replacement, arthroscopy, and the newer advances that are there. And so I will not take more time in this field. Once again, welcome Dr. Ashish Arbhat. It's such a pleasure to have you as usual on our platform, and it's always so much of learning, and we are aware how much deep you are into your in your work in everything that's coming up all around the world, and you've actually worked in the US, UK, Japan, so you've worked all over the world. So I think it'll absolutely be I mean, for the viewers, it's you have to understand that this is something where you can get authentic piece of information, anything and everything that you want to ask it. So with that, I think Dr. Albert, before we get on to the topic, I would of course want to talk a little. Healthcare professional has been managing it through these times, and how are your patients really feeling? What's exactly should go for a surgery or not? How well planned they can go, and what can they do?
Hi, Rajeshri, and welcome, and thank you for the very openly. All of us understand, सगळ्यांना आपल्याला माहिती आहे की पॅन्डेमिक आहे, पण पॅन्डेमिक हे आत्ता आलेलं आहे. ऑफ 10 लाख इयर्स, 10 लाख वर्षाचा आजार आहे. सो हा आजार किती इम्पॉर्टंट आहे ह्याच्या मागे न जाता ना, आता ठीक आहे. आणि जसं यू टोल्ड अस, लाईक देर आर नियर अबाउट 6 मिलियन पीपल अराउंड इंडिया, म्हणजे 6 करोड लोक आर सिटिंग डाऊन विथ ऑस्टिओआर्थरायटिस in a mature way, that we should see the silver lining under the cloud. Say like the US is going or the UK, they are thinking ki these are diseases which are important. Disease is the osteoarthritis. We cannot just ignore it and sit on it. We can wait. And this series that we have planned is for the people to take a good decision. Luckily, they have got some time that they can see some doctors like us and take a different call on what they can do in this waiting. And they should go to the media. They should understand that social media is helping them, and they can take a call. What happens is, uh, during routine life we just go to the shop nearby, but if you have online platform, I can shop pan world like the Amazon. So this is one of the platform. And this series that we are talking, it will be an educative series for the severely affected. Rajeshri, we are, now you asked me how are you feeling, we are still continuing with the work. Trauma is going on, ligament injuries are going on, the people who are bedridden, joint replacements are going on. Hospitals and doctors now are hand in hand with the COVID. We have learned how to manage it. We have learned how to. There is a herd mentality, especially in countries like India, where the healthcare services are not providing enough. But uh, yes, now you can take call. Now you can plan it out. This is a planned procedure. And believe me, Rajeshri, osteoarthritis and whatever we are talking is not a disease. It is not an illness that will come and go. It is a degeneration. It is going to stay with you, like your cataract, like your toothache. It is going to stay with you. It is not going to come and go, because it is not a disease. COVID will come and go. Osteoarthritis, kidney ailments, heart issues are there in your body. We should be afraid of any particular thing till it becomes a phobia. So, what is the difference between phobia and fear? Fear is okay, you become alert, but phobia, you take wrong decisions. So, you don't be phobic about all these pandemics. Phobia matlab you are just hampering your day-to-day life. Don't go in the herd mentality of phobia. Even in India, if you talk about, we are not talking about the pandemic, the cured cases are more than the infected cases. The death rate is marvelously and humongously low than the Western world. So if you have some spine issue, if you have some osteoarthritic issue, which is keeping you bedridden, even I have patients who have to go to, they have to be given pots on the bed. They can't go to their toilets. Good surgery done and going back to normal. In my previous talks also, I said there are so many patients who underwent joint replacement couple of years back. They got COVID. First patient in India was a bilateral TKR patient who got cured, Mr. Kapoor from Delhi, on record. So nothing is going to go wrong if you are a joint replacement patient. And this virus, understanding of what is the latest happening and why we are moving towards all these latest things, so that we can give you some results which are going to be there for your life. Because if the body is fit, if the body is right, you can fight any disease, not vice versa. Rajeshri.
Totally. I mean, I can't much agree, and which is why I think we really wanted you to be here to address, of course, these things, that if how safe it is for people to, actually come out there and get their surgeries done, instead of actually uh, we are not realizing, but it's already now 5 to 6 months that we are locked down, and people are going through, especially the older population is going through a lot of excruciating pain, and like you explained those cases. So of course I would urge to patients to actually listen into these shows, and there is so much going on the internet, but choose the right programs to actually get the knowledge. And it's not very easy, but that is the reason why we have relentlessly been doing programs for the last 4 months, almost every day, trying to bring authentic talks on this platform. And we of course can vouch for what Dr. Ashish Arbut will tell us about osteoarthritis and the techniques that he is working on, because we have seen ourselves have seen a lot of his patients, and you will also of course see that through this. I'm sure Dr. Arbut, you will be sharing some of your patient videos with us this session. So I will go on to the real questions, which I think the viewers are waiting for from the standpoint of the disease condition. Everyone keeps talking about arthritis, osteoarthritis. There's a lot of confusion actually understanding what osteoarthritis is. Now these days, even people know, they have heard these three letters TKR, and it's an acronym that we can easily remember, but how many of really us really understand it? So if you can,
Let me share a video so we should
yeah,
understand what is osteoarthritis and explanatory video. I hope you can see this.
yes.
So human body, there are certain structures. काही असे structures असतात ज्याला एक particular life आहे, like your lens in your eye. And why are we humans? We are humans because we stand erect. And the greatest thing that we have is the standing erect. So this is what I was talking about. This is the knee, an example, and this white covering here, this is the cartilage. And this is what makes you walk. याच्यावर चालता तुम्ही, याच्यावर बसता, याच्यावर सगळं करता. Even if you want to go to any hospital, years and years to come. But with aging, it starts degenerating. त्याचे पापुद्रे पडायला लागतात. Somebody starts it at. So there is a question that can I prevent all this? No. If you are genetically prone to it, so like these 6-7 million people, they are genetically prone to it because this is a disease. This is the early stage. You start getting osteophyte from 1, 2, 3, and 4. You get severe pain, something like discuss in our next lectures about the conservative management of diet and to prolong it, not to come out of it. And this is the stage 4 that.
So clear video where you can really easily understand what exactly osteoarthritis is of the knee, and of course when you can actually go in for a surgery. So having discussed that, these days, we keep hearing about a natural knee, and a natural knee, as in we understand, is a natural knee even achievable, Dr. Arvind?
Yeah, it's a good question, Raj. I have something to show you. So now this is your knee. Okay,
Yeah,
this is what I was showing in the video. So
yeah.
this is what your cartilage is degenerated. I hope you can see it. Comes this cartilage the doctor replaces. But in the conventional replacements, what used to happen is they used to replace the whole knee with something like this. There was a part which was in below here, and most of the conventional surgeries are done in the same way. Sorry,
Okay.
uh, the cartilage below, and this is a whole knee. This is a total knee replacement. But what used to happen is only one directional movements used to start, and people never did any activities which they used to do before. They used to just walk in a straight line. So around 30, 40 years, 35 to 40 years, this has been going on, and people are still doing this. But if you now you ask me what is a natural knee, the problem is our knee is unequal.
Mm, yeah.
The condyles, say the upper bone called the femur, they are unequal. So what happens is the beauty of this knee is it is not a lock and key mechanism. It is not a ball and socket joint. So the viewers should understand is why do we sit down? Because our lateral condyle, जे बाहेरचा condyle है, it is thinner like a cycle tire. It is a bit below, and the medial condyle, the मधलं condyle, it is flatter. So what happens? A human being starts sitting cross-legged, and the rotatory elements are these ligaments. So natural knee should have all these ingredients, right? So if a surgeon cartilage, saving all your ligaments, saving specialized in something the lost cartilage,
Oh,
keeping
okay.
all the ligaments and everything okay. So you and placement is done with the help of robotics. That's what we are going to discuss today. So this
So
is
does,
natural knee, and
sorry.
something it looks like this.
Mm-hmm.
So it's a natural knee. You can sit. The condyles are exactly patient specific, and you can cross-legged sit. It's a rotating platform. You can do all the activities. And in our coming series, we'll be discussing what the patients can do. They are doing yoga. They are doing sports. They are gymming. Uh, we are just replacing the cartilage, and this is not what the conventional doctors do, and that's where the patient should reach us and talk about a natural knee replacement with or without help of robotics. help of robotics?
So, viewers, I think you must have noticed that there are so many different types of implants which Dr. Albert just showed us, and which is what actually can confuse us when we go into the go to the doctor, and when they are trying to make us understand, and then may not be the same for you. It all really depends on the understanding. I always call it wisdom and expertise that is needed to give you exactly what tailor-made solution you need, a well-made one. And if that is the kind of scenario, I think Dr. Albert, we are also going to do more specific sessions. So I think in those, again, we will be going over these different implants so that the patients can even get a more deeper understanding to it. But it was great to
Yeah,
see
Rajeshri,
all
if you
of.
can add on this,
Mhm.
see, all
Yes.
of us upon Sagre Indians out, and I am from basically born and brought up in Kalyan, Thane, and Mumbai, and so many years in Mumbai. And when I went to UK, and when we started, luckily what happened is, so why everybody is not doing robotics, or luckily my batch in the UK started day one with the machines, and we started with the initial robots called the navigators, navigation machines. The whole idea is to have one computer with you, like your first assistant, to tell you what the patient needs and is it engineeringly right. See, medically we have come very right. Doctors say that conventional surgery works and all and all and all, but problem is what we'll be discussing now is it right for that patient, is it patient specific.
Yeah.
So coming to the trainings in the US and UK, the first thing what I found the difference,
Mhm.
Rajeshri, and I would like to tell the viewers, and
Yes.
when this video gets on record, when it boosted and all, we really don't know in this part of this world our rights. Our right is to remain healthy. Our right, human rights, basic rights to move. And what does the Indian need? He needs to sit down. He needs to have choices.
Right.
The concept of even the Starbucks, everybody gets a different coffee. So we are totally against this old conventional surgeons, and nothing against them. They're doing a good job. We choices, and there is no value for choices. Amulya hai. And in natural, we have near about 7 different in 3 dimensions. We'll be discussing on use of natural knee, plastic surgery with it, stitchless, painless, with the use of 3D robotics. So that is all combination of natural knee, Rajeshri. So that's what the viewer should understand. So they are getting their choice. की डॉक्टर हे
Yes.
नी माझ्यासाठी बनलंय का. It is for you. Patient specific implantation is what we are planning. And so they should not compare. What happens is आमच्या बाजूवाल्याचं काही झालंय. Please understand, त्यांचं कन्व्हेन्शनल TKR झालेलं आहे. आपण
Yes.
कन्व्हेन्शनल TKR करतच नाहीये. Please
Correct.
understand. So don't compare. You compare with our patients and you will be
Yes.
happy. It is like stenting versus open heart surgery. Nothing is good or bad. It's a technique. So
Right.
nobody should be offended. There is no offense in, I'm being very humble because somebody might take it personal, but that's a choice. It's like you don't need an automatic SUV. You needed it. So there
Yes.
is nothing that the bike company should say, no, Ferrari is bad or good. So this is your choice. You need a sports car. You need a sports car. Why do
Right.
I give him a bike? This 7 8 types with the additional of newer computerized anesthesia with computerized surgeries, you should choose the right doctor who
Right.
gives it, Rajeshri.
So that will sort of bring us to the a few questions that of course I am receiving. A couple of them is when should we be actually going to the doctor, because we are understanding what you have been specifying. I think what seems to be most important is to come to you at the right time. So there is possibility of doing a partial knee replacement, which can actually help us keep our natural movements even better. So earlier the better. When should actually, but what type of pain they should come to you, and then of course another question which has also come, which is related from a viewer. I'll ask you that. But first,
So Rajeshri, understand one thing. We
Mhm.
are not treating pain here. Pain is a language that the body speaks with you. Example, you get a heart attack, you have pain. but that pain is or something. Understand?
Yeah.
In that analogy, arthritis will give you pain in the first and second or third stage. In the fourth stage, you might not have pain also. What you have is deformity, not able to walk, not able to do your daily course, not able to go to the toilet, not able to do anything that you are planning in the retired life or in the office life. I have so many policemen, sportsmen. Greatest example now is Shoaib Akhtar. He's not able to even run. So in that kind of people who want to live their life, joint replacement is not an obsolete procedure. It is an in-between procedure which you can go back to your normal life with a better and nice intervention. प्रॉब्लेम हाच झाला होता की जॉइंट रिप्लेसमेंट इन द कमिंग एराज द लास्ट डिकेड और दिस डिकेड वॉज की आता सगळं संपलंय, आता जॉइंट रिप्लेसमेंट करायची आहे. प्लीज, इट इज नॉट रिमेन लाईक दॅट. You start getting pain, you need more than 15 days in the knee, you need to see a specialist, and who can give you all these options. See, what happens is, what I have seen during my training years is, this is a joint replacement surgeon, you go into the end stage. This is a conservative surgeon. No, we are the byproducts of learning from all these doctors. We conserve. Now there will be a complete session on for the young people. We do laser surgeries and cartilage replacement. We do partial. We do there are techniques now. We take the cartilage, regrow it, and put it back. Then there is a bicondylar natural knee replacement, and then after that, the fifth part is a total knee replacement. Imagine the fifth option is what you are getting right now. We have 4 more options to you in the kitty. Please understand, osteoarthritis should be taken as a degenerative process, and never as a process that आता सगळं खराब झालंय. And so your question